So some people who are coming in for breast implant exchange, they have what's called a mild Snoopy nose deformity. What that means is that their nipples are a little bit low and kind of hanging off the implant like Snoopy's nose. So at the time of the breast implant exchange, they need a donut or periareolar mastopexy or lift. And the purpose of the mastopexy or lift is to position the nipples to the correct location as well as tighten up some of that loose skin. And the final scar is a circular scar around the areola. So if somebody does need a periareolar lift or periareolar mastopexy, donut mastopexy, it's all the same thing. At the time of the breast implant exchange, I will use that incision, that circular incision, to also access the pocket and remove the old implant and put in the new implant, as well as any other maneuvers that are needed in the pocket to better maintain the position of the future implant. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.